Hello and welcome to Connected with Latham, where we discuss ideas, legal developments, and business trends shaping the global economy. This is the 26th episode of the Latham & Watkins Drug Pricing and Market Access series, and I'm Chris Schott, a partner in the healthcare and life sciences practice in our Washington, D.C. office. I focus my practice on all things market access, and that includes manufacturer compliance related to the Medicaid Drug Rebate Program, Medicare Parts B and D, and the 340B Drug Pricing Program. I also advise on current policy initiatives such as the evolving Most Favored Nation drug pricing issues, Globe and Guard, the ongoing implementation of the Inflation Reduction Act, as well as state law developments. Joining me is Danny Machado, an associate in our Washington, D.C. office.
Hello, Chris. Great to be here with you today.
Thanks, Danny. We are very fortunate to have Rujul Desai as our guest today. Rujul is currently senior counselor at CMS, the Centers for Medicare Medicaid Services. He previously served as Deputy General Counsel with the Department of Health and Human Services, and before that was a partner at Covington and Burling. Rujul, welcome, and thanks for joining the podcast. And maybe I can turn it over to you so you can introduce yourself.
Thanks, Chris. It's great to be here with you and Danny and excited for this conversation. Hopefully my name is familiar to some of your audience, as you know, we've all likely been around this space of drug pricing for many, many years. I'm fortunate to have built a really rewarding career, having been on multiple sides of the market access, supply chain, dynamic, from time working on the PBM side to biotech and biopharma manufacturers, as well as a partner at Covington in their healthcare practice, and now had an exciting journey so far in my role in government.
Rujul, thank you for joining, and we really look forward to hearing some of those insights based on this diverse experience that you've had, especially, of course, with your current role at CMS. In each episode, we focus on a specific topic that is relevant to market access, drug pricing, or the pharmaceutical and healthcare sectors more broadly. And after discussing the substance, we ask the question, which Olympic sport is it like? And we have the list here of Olympic sports to see which most resembles the topic in terms of strategy, complexity, or frankly, level of conflict. So, Danny, what is our topic for today?
Yeah, well, today we're very fortunate and excited to hear from Rujul about some of the key topics that CMS is focused on right now in the pharmaceutical space, topics that many of our listeners are tracking very carefully, such as Most Favored Nation, or MFN, Trump RX, which we all have heard much about, as well as addressing fraud. And hopefully with Rujul's experience in private practice and now also in government, we hope to learn what it's like working for CMS, as well as the various CMS initiatives to build up its career staff.
Thanks, Danny, for kicking off the conversation. And maybe we start with this last point, this transition, right, from working for big law, now working for government. Rujul, can you share what it's been like to get the call for a senior appointment in the administration, to leave the law firm, the major roles you've been asked to take on since joining the government, and also just from a day-to-day perspective, which leaders and parts of the administration do you interact with?
Happy to do so. I will tell you, it was quite an unexpected call when it came after the last election. I don't have a history of heavy political activity, but am known, in this space, as are you, for expertise on core areas and policy issues around healthcare, and particularly drug pricing, PBMs, and the like. And so, my name got floated around to some folks, and I got some outreach and ended up having a really good conversation with a number of folks that were about to go in and really focus on the lane that I know most and passionate about, which is the CMS lane of HHS. And given the fact that, these are programs, Medicare, Medicaid, and others that I've been working on for my entire career, the chance to kind of go in at a very senior level, work on both legal and policy issues on our program that, as you know, has grown to about $1.8 trillion annually. It's bigger than the military budget. And so, it was time in my career to make that impact and, talk to my partners about it. And everybody was very supportive. There's a long history in firms like yours and at Covington for doing tours of duty in government service. And I think it's both a privilege and a duty. I'm a, immigrant to this country. And so, standing up and doing public service, whether it's my prior military service or this role in government, for me, is a bit of a payback for the opportunities that I've been given.
Thank you, Rujul. It sounds like you're working on some really high-profile efforts and leading very consequential teams at CMS. And thank you for sharing your story on how you got there. Chris and I have seen in the trade press that CMS seems to be building back up its career staff, including its lawyers. So I wanted to ask you how that's going and in which areas you see the greatest opportunity to make an impact, particularly for anyone who's interested in pursuing a career at CMS.
Appreciate the question, Danny. And I think that is a core reason why I'm here is I'm helping get the word out along with Dr. Oz, along with Kim Brandt and Beth Kelly and others that are serving either in OGC or in the CMS operating divisions that we are absolutely hiring. There's a significant amount of postings available. I think we're going to ramp up to about 30 postings a week, very soon on the CMS side. There are a number of great opportunities in OGC, Office of General Counsel, to work on program review issues, program integrity, litigation. And we have to be honest about the fact that, we went through a very turbulent initial period in the administration with a lot of the efforts around DOJ, resulting in a number of staff, deciding to take voluntary exits from both CMS and the legal divisions. And we are fully committed to staffing back up and rapidly. And there are literally thousands of jobs that are going to get recruited into, including just within CMS. And so what I tell folks is, one, these are career opportunities. So, you go in to do substantive work. You're not asked to be a political appointee like myself. And so you could also look at the fact that if there are certain programs you've always wanted to work on. You were always fascinated by the Innovation Center. There's great opportunities within CMMI. If you want to go in and say, I'm really focused on how IRA is going to continue to get impacted, whether that's on the policy side or the legal side, there's a real openness to have a discussion about people being able to maybe tailor their own remit in an area where we are doing so much hiring. So I think the opportunity's never been greater. If you want to make an impact, including whether it's at the line level or senior level roles, I welcome people to come in, because as we talked about, these issues are massively important to the American public. And there's a tremendous amount of policy work going on across all the different centers that make up CMS.
Well, thanks, Rujul, for sharing some of these opportunities. And it definitely sounds interesting, this overlap from the legal practice into the policy world. So obviously in our day-to-day lives, we encounter that, but we can always sort of advocate, but never really work on the policy. And clearly, you're talking about opportunities to kind of get involved at that level. And maybe with that, we turn now to some of those issues that you just, glanced at or referred to. Rujul, given that you've spent over 25 years working on these strategic, legal, and policy issues related to drug pricing, payer PBM dynamics, digital health, can you give us a peek into what it's been like to have a senior role in a Republican administration that's made these areas a top priority? Which areas have you been asked to lean into that you didn't expect?
Absolutely. And I will say, one of the pivotal aspects of this answer is who the current CMS administrator is. So Dr. Mehmet Oz is a tremendous public servant. He's got tremendous energy, intellect. And when he was interviewing all of us and leadership team, folks that came out of law firms or came out of McKinsey and prior folks, he was very transparent about the fact that he had an ambitious agenda, that he saw program integrity, fraud issues, reshaping these programs in a meaningful way. And in the earliest days of the administration was going to be what he was going to drive towards. And so you really needed to lace up your boots, or running shoes, I should say, and be ready for that sprint. And that's what it's been the last couple of years, for sure, both in my original role as chief legal officer, managing the 150 so lawyers that at CMSD that support CMS, and they do a tremendous job day in and day out, as well as in my newer role, diving straight into policy, being a senior counselor. And in some ways, we always knew that issues like MFM were part of the previous administration, so they would likely pop up again. Maybe I wasn't as prepared for the amount of effort and attention that area would get. So that's been a little bit of a surprise. We'll talk more about that, I'm sure, during this podcast. It's great to be in at a time where PBM reform also was passed, on the congressional side. And now we get a chance to pull through a lot of that on the regulatory side. And that's going to be really exciting, as well as just the number of innovation models that we've been able to stand up and release in a year. Folks like Big Sutton and his team, tremendous amount of credit. And so it has just been go, go, go from the start. And I was warned, but I wasn't quite prepared to be as exhausted as I am, but it's incredibly rewarding to be part of the team.
Well, thanks for sharing that. And let's not jump ahead to the Olympic sport, but you did mention sprints. So we're talking about sprinting here. You mentioned one key topic here that everyone's focused on with extreme focus on the pharma industry, and that's the Most Favored Nation policy. I'll just recap real briefly, right? We had this announcement of now 17 deals with major manufacturers, followed by 3 CMMI payment models, Generous, which is the voluntary Medicaid model, and then Globe and Guard, which are the proposed mandatory Medicare Part B and D payment models. And I heard from one of your colleagues at a recent conference that on Globe and Guard, there were 20,000 comments that you received. So it doesn't sound like your life is going to get easier working through those. But on this topic of most favored nation or MFN pricing, it seems that related discussions with the pharma industry have resulted in many offshoots and new pillars that many hadn't anticipated. What can you say maybe generally about how we got to this point and where we might be headed?
Sure. Happy to give you, Danny, and your audience a little bit of a behind the scenes as I can around the MFN effort. And one thing is, this was clearly part of the last administration. It was late in their term that they put it out, but it shouldn't have caught anybody by surprise, right? That there was going to be a significant effort around some form of thinking about getting Europe to pay more for innovation and valuing innovation in a more rebalanced way than we have historically. And so that was a critical part, and certainly executive orders that get put out on that, you see attention. And one thing I'll say is, with these executive orders across a number of policy areas, what it does is it creates a forcing mechanism, right, for folks to get together on a very regular basis and report out progress, right? So this is, when you have an executive order like this one or others, it usually is a cross-agency dynamic. So people come together, whether it's the White House, whether it's HHS, it might be labor on the PBM side, it might be others. And so those kind of force action in a meaningful way and really set the intent to move forward. And what we did was really say, well, first, let's just have a discussion, right, with industry and amongst ourselves around what's the option set in this area if we are going to think about, getting Europe to value innovation in a more meaningful way and really have a fair deal for, the American taxpayer and those government programs and CMS as a major payer. And so in that regard, we had a number of meetings with industry that went really well, in terms of just dialogue on what's the art of the possible, when you look at different things along the spectrum, which will have the most significant impact versus ones that might be a little more digestible for industry, especially maybe in the early set. And then we also did the same thing internal, having sessions with different folks in the administration to say, what are the different ideas on the table that people have posited would like to see. And from that, we ended up with a narrow set of like 4 pillars that you've seen that went out in the letter to 17 manufacturers to say, we really think would like to see you come to the table with a discussion around, MFM pricing going forward. So some time to get acclimated to launching new products at MFM pricing. Also to think about providing MFM pricing now in the Medicaid program through supplemental rebates. And we did that intentionally because you don't have the 340B, impact on the supplemental rebate side of Medicaid as you would if we did it otherwise, right? So being thoughtful about the timing dynamic for newly launched products, also the kind of overall impact around Medicaid by using the supplemental lever, and then the DTC platform around which became Trump RX, which I'm sure we'll talk more about. And then also thinking about how to bring back some dollars to the extent we're able to help renegotiate or rebalance some of these investments in innovation with European markets. And you've already seen us come through on that with the UK. So, after decades and decades of not willing to change how they value innovation due to significant efforts on our part, USTR and others, we were able to publicly announce a deal, and we're working on more with others. So, that's been kind of part of how this all came together from a genesis perspective. And obviously, some of this is now being effectuated, especially on the Medicaid MFN portion, through a voluntary CMI model called Generous, which I'm spending a lot of time on.
Thanks for that insight, Rujul, particularly hearing you talk about behind the scenes, how the executive orders really force the action to take place, where sometimes maybe things would take a little longer if it wasn't because of the nature of these executive orders and how they really drive the maybe change at CMS that needs to be a little faster than it has historically been.
I'll also say the president makes a lot of phone calls, especially to Dr. Oz, about, where are we as we had sent out 17 letters. And as we got through, and it was great to see, industry came to the table had really fair, fulsome discussions. The shape of the deals have been a little bit different depending on which manufacturer. But, when we got to 16, but hadn't got to 17, there was a lot of calls to Dr. Oz about, from the president in particular, like, where's 17? 16 is not 17, 16 is not good enough. I want 100% completion rate. And so it was great yesterday in particular we had the office announcement with the leaders and founders of Regeneron to announce that deal, and they did have a special twist to their announcement as well, which is a significant milestone where they've got an FDA approval yesterday as well for their gene therapy product around a deafness in small children. It's a rare product, and typically you could see manufacturers charging millions of dollars for a product like that. And they decided that based on their overall portfolio, they were able to make a commitment to provide that absolutely free to any U.S. patient going forward, which was a tremendous day and event in the White House.
Yeah, yeah. Thank you for sharing that. That's incredibly timely. And I guess on that note, because we're talking about the executive orders and the 17 manufacturers that made deals with the Trump administration, I wonder if we can spend a minute or two talking about the fact that it's been clear from the start that one pillar of the MFN policy is making drugs available directly to the consumer or through the DTC channel. And that was implemented, at least initially, through the launch of TrumpRx.gov. And I wonder if you're willing to speak to it. What was the driving desire to include that particular pillar and how it's going so far?
Sure, happy to do that. I think it's really been kind of a novel and exciting, aspect of what we've been able to do through the overall MFN efforts is to draw more attention to potential direct to consumer channels that some companies, foreign companies, in particular, had leaned into maybe earlier rather than others. And look, let me say at the outset, we want people to use their insurance. So we're not trying to drive people to DTC to spend more, when their copays cover the product. But in particular, you've had certain products like fertility products, GLP-1 products in particular, where often they're excluded from formularies and they're at price points that Americans might be able to afford. And we were in both those cases, like for example, Gonal-F or with the GLP-1 products, we were able to get some commitments to even drive that pricing even lower when they were listed on the DTC platform, which eventually became Trump RX. So that was part of the goal, right? But another one intentionally was when we show these concessions that manufacturers are making, which are massive, right? When you look at the gross to net, I mean, they are providing tremendous value back into the supply chain and channel. And what it shows employers in particular, self-funded employers, is they're going to ask the question of their brokers and their PBMs and saying, why am I not getting this deal on the drugs that I'm paying for, through my benefit design? They're clearly being offered. It's clear that manufacturers are giving this significant amount of value back in the form of pricing concessions. Where's all the money going? Why am I not getting the full benefit of the bargain? And that is already starting to force harder conversations through the different ways in which PBM revenue models work. But that was intentional as well, right? And I think it served both those goals. And I think over time, we may do more things to really make it an affordability, transparency related, website, but it's been successful in those outcomes. But in designing it, we also were not going to give a top down approach to tell manufacturers, you have to do DTC in this particular manner. We know that there are different models, and in particular, there are three kind of main pathways that people use, and you'll see them on TrumpRx today, whether it's a kind of traditional discount card offer where you can take any retail pharmacy and it uses a BIN PCN code, or is it something more similar to kind of a captive or white labeled pharmacy model, where you're going to get back to the manufacturer site to go get dispensed out of, or will it be kind of a more limited mail order network model like on the fertility products, where you might have certain specialty pharmacies in particular that have been contracted around. So we didn't restrict manufacturers from which pathway and flow they wanted to create, as long as the pricing was very visible, it was an all-in price, and then that was going to be effectuated on the other side. And it's given some time. Some manufacturers were ready to come on board very quickly, and so it took us. Others hadn't done as much DTC, so they needed to get their efforts in line, just both from a technology and operations perspective. And then we were also in the midst of all this, worked closely with OIG to issue a special bulletin on certain EKS risks around DTC platforms. Those manufacturers that hadn't opened up their terms for government beneficiaries might be more inclined to do so. And that's proven out as well. So I think on a lot of levels, this pillar in particular has already been a big win, for both the administration and for Americans and for manufacturers to showcase, these products.
Yeah, that's very helpful to hear kind of the backstory. And yeah, we're definitely aware of the full court press that you guys did with the OIG announcement, with TrumpRx, all these things kind of coming together.
let me add one more aspect of this, which has been really intriguing, is just the technology to build up and launch. Because remember, we announced Trump RX in October and launched it in the first days of February. We were ready to go last week of January, but timing on the announcement got it to first week of February. For the government to build and launch a massive program to all Americans, and we did it on live TV and took it live exactly at the same time and did a live demo. The partnership that this administration created by launching what's called the National Design Studio, which a lot of people aren't familiar with, which sits under the White House. It's run by Joe Gebbia, who's a co-founder of Airbnb, and he's got a team of engineers that do amazing work there and state-of-the-art technology. Built a really resilient website, massive crash testing going on beforehand, and it's been stable, secure, reliable. And we've even got features like adding coupons to your Apple Wallet that you don't see on any other platform. So just the ability of government to deliver technology innovation at a rapid pace and launch a GTC platform like this, I think was an amazing experience to be a part of. And so I wanted to give that behind the scenes shout out to the National Design Studio in particular.
Yeah, fascinating. And we certainly were. We had our internet browsers open, and we kept hitting F5 on the day to see is it coming on, and like it came on, it was there. Yeah, so we definitely were tracking that. So we've mentioned a couple different initiatives here, and you alluded to CMMI already a little bit. So we've talked about the 3 MFN payment models, the voluntary generous, and then the proposed Globe and Guard. So it's clear that CMMI has been very active in this administration. So beyond these MFN models and MFN initiatives, another area, of course, is digital health. Rujul, can you please talk a little more about the access model and the types of policy levers that this model is specifically testing for?
Absolutely. And thanks for, raising the topic with CMMI. And I believe the stat is accurate that we've done more models in 1 year than the last administration did it for. Right. And obviously, volume is not necessarily synonymous with driving amazing outcomes, but the fact that we've been able to stand up and re-envision a number of models that will not only drive the policy forward, but also think about cost reduction or budget neutral dynamics has been a core touchstone of the way in which we think about CMMI models in this administration, I think going forward, hopefully as well. But digital health is another kind of passion area of mine from a policy perspective. One of the reasons, I answered the call to serve, and one of the reasons I, transitioned from more of the legal management job to be able to get more deep into the weeds as senior counselor to administrator on policy in the second role, which is the access model is really intriguing because it has both an outcomes element, a payment for outcomes element, and enabling of next generation technology element here. So what the access model is looking at is certain chronic disease states. It's a voluntary model, runs over 10 years, but we're looking at, chronic areas like behavioral health, musculoskeletal, other issues, and said, we're going to pay, but we're only going to pay on an outcomes basis. So you have to show improved performance as a baseline to get any kind of payment out of the model. And so we're no longer paying for activity, right? Which is the key, right? We got to move the system from paying for just doing activity and checking boxes and billing codes to saying, no, we've taken accountability for a patient. We've measured a baseline of where that patient is, and we're going to drive to a new outcome and then get paid when that new outcome is achieved. So that's a core aspect of the model. Secondly, we want to do that in a way that enables next generation technology and more disruptive technology models. So I think one of the key ways in which we're going to see management about 1.8 trillion in healthcare spend that I talked about get flattened or come down over time is to encourage the technology industry to disrupt healthcare in a more aggressive way, because they're not used to the legacy margins that traditional providers are. And so they're willing to look at opportunity sets in a new way. And this model shows that, right? And so what we did in setting the payment rates for the model is they are less. One, you have to achieve outcomes. But if you achieve outcomes, you don't get paid at the same rate you would have if you had just checked a bunch of services and build those codes, right? And so part of that was to really see who would come to the table and embrace the model. And so what's happened is the technology-enabled players, the ones that want to be more disruptive and still provide meaningful clinical value and are coming into the model to do, whereas, legacy providers are may not want to, do that going forward. But that's fine by us because that helps us encourage a new generation of technology disruptors to come into healthcare and at the same time deliver meaningful outcomes to patients in chronic therapies where you see kind of cost year over year needing to get managed. So it's a really exciting way in which to use the innovation center. And I think digital health is an area that doesn't get talked enough about when we look at the accomplishments and activities around this administration.
I'm actually glad that we took a little quote unquote detour or time to talk about the access model here, which sits maybe a little bit outside of our typical drug pricing topics, but certainly helpful for myself and I'm sure our listeners to keep perspective on the many efforts going on at CMS and CMMI. And as you were saying, Rujul, particularly this use of technology to really disrupt and help drive savings. So along these notes, another topic that has been receiving a lot of attention recently is fraud in the federal programs. We see CMS leading the charge on significant efforts to tamp down healthcare fraud across programs and improve program integrity. So I wonder, Rujul, if you have any insights into how that effort is going and what the outlook is for more work, particularly on fraud.
Absolutely. And, this starts from the day one conversations as the administrator, Dr. Oz, was calling the potential folks that would become leaders on his team or support his team, from the legal side, as I did initially, which is to say, again, we get back to $1.8 trillion in annual spend. There has to be a more aggressive look at fraud on the system. And we spent a lot of time talking about that when I was deciding to take this role in particular with the administrator. And you could tell the passion was there from day one. He was going to make that a top priority. And he has, and the administration has. And we've been, whether it's through the Center for Program Integrity, whether it's through our collaboration with state AGs, whether it's some of what we've been doing with DOJ, whether it's the new task force that the vice president is going to be leading or is leading around healthcare fraud, we are leaving no stone unturned in this area. For example, CPI had set up an amazing kind of technology effort and push around this area to really search for opportunities to tamp down on fraud in ways that hadn't been done before, thinking about best practices across DOJ and CPI in terms of data sharing and the like. We've certainly been very vocal about what's gone on in some of the Medicaid programs in states. You see a lot of press in Minnesota, for example, in that area. And some of that, quite honestly, is just that this administration was willing to listen to whistleblowers that have been saying things for a number of years that for some reason or another had not been, followed up on and followed through on. So some of that is renewed effort on our part. Some of that is just us picking up and following through on whistleblowers that were, and Minnesota is a great example of that, where they were sounding the alarm, and the folks that are running programs were choosing to ignore it or not follow through it in a zealous way. And the other thing I'll mention as we think about fraud, waste, and abuse, and I think this is important, especially for people that practice in this area from an enforcement litigation support perspective, is to think about, I frame it in a different way going forward. I think it's no longer fraud, waste, and abuse. It's fraud, waste, and abuse and gaming the system. Okay. And I think getting to that next layer is critical if we're going to protect the integrity of these programs and not have skyrocket expenditures in these programs where it may not rise to the level of intentional fraud, right? But people have figured out loopholes or areas to aggressively push through. And I think CMS is now and is going to be doing a better, more aggressive job, I think, at looking at gaming opportunities and thinking about more aggressive and more quickly issuing out clarifying guidance or other things to prevent gaming. And whether, you can look at a range of examples, gaming is going to become, it has to become a part of that equation going forward for any administration if we're going to keep healthcare costs in a way that's sustainable and where the value goes to actual care that's needed at the end of the day. So I think people should be on the lookout, I think, as we go forward for more and more aggression related to gaming the system that goes beyond just kind of traditional intentional malfeasance and fraud.
Well, speaking of gaming program integrity, somehow my mind wanders to the 340B program. So there have been quite a few developments there. Maybe I'll just highlight a couple. We had the rebate pilot that was withdrawn, and now current efforts to initiate a new rebate model. We're seeing manufacturers taking more action in the way of seeking claims level data. And then, of course, there are a number of lawsuits in progress challenging different aspects of the program. And I'll just say briefly, grab the Doe contract pharmacy laws in the states, which are of course also subject to litigation. So I don't know if you're in a position to say much on this topic, but I have to ask about 340B given the growth of the program. And that's, of course, a hot topic in DC in the legal and policy circles. I mean, I'll just say we saw in this recent president's budget and also in the one for the year before that there's this proposal to transfer 340B program oversight to CMS. Rujul, is there anything you can share on that exciting topic?
Well, Chris, I knew I wasn't going to escape this podcast discussion without some conversation around 340B, given it is probably the topic du jour, as you say, in town across stakeholders. Look, I'm not going to make any news on this podcast around any transfers of programs from one area of HHS to another, if that were to happen. But I will say, look, CMS itself had historically had equities around the 340B program, especially newer ones with inflation rebates and MFP effectuation and the like. So obviously we've been engaging much more on the CMS side than historically around the program. And I think, all stakeholders need to be at a place where people can have kind of trusted transactions that happen around any major government program, right? Whether that be the Medicare program, the Medicaid program, or the 340B program. I don't think there's any kind of special carve outs for one program versus another when you think about the need to have kind of integrity around the program and a trusted set of transactions, especially if we're going to have kind of risk of duplicate or triplicate payments in some areas. And I would think any policymaker would think about how do you fairly balance, the burdens in order to achieve that level of trust and integrity, whether it's on the provider side, whether it's on the manufacturer side, whether it's on the contract pharmacy side. And, this is a program that has seen absolutely significant growth over the last decade, in particular, as we saw the expanded use of contract pharmacies in particular, but that also means that they have data in ways that wasn't available before, or maybe easily available before. So there may be some opportunities where you look at contract pharmacy data in ways that relieve burden from traditional providers having to provide it. But I do think it'll be a continuing topic of interest both within CMS, HHS more broadly, as well as you can see on the Hill. And, we certainly take plenty of meetings on this topic, both from all sides of the industry. And I think what we've gotten a reputation for on the CMS side, and particularly under Dr. Oz's leadership, is that we're not playing favorites across any particular stakeholder in the industry, including some of the more aggressive policy areas. It's providers, payers, pharma, pharmacies. We are, holding all stakeholders accountable, given the desire to drive program integrity and make sure that we're managing on behalf of the taxpayer this massive amount of annual budget, bigger than the military budget, in a thoughtful way. And so, we look forward to engagement in this area, and it's certainly an area that I've spent a lot of part of my practice in, and so know well, and certainly enjoy working on policy issues. But again, I'm not here to make news on the program today.
We'll have to wait for the big news, if any, at another time then. For now, I wonder if we can loop back maybe to practice point, Rujul, with the many, as we've been talking about today, new developments that are going on, and perhaps even going back to the Biden administration and the Inflation Reduction Act and the many changes that flowed from that. There is a need for stakeholders to carefully track issues and adapt, which is something that Chris and I have discussed on prior episodes of this podcast many times. Rujul, you have yourself spoken at many of the industry conferences, and you are here now on our podcast. So clearly, you're committed to sharing important information with lawyers and with professionals around the many complexities of market access and drug pricing issues. And that is a growing practice area and an area of focus for, I would say, many law firms now, policy shops and consulting firms, as well as, of course, in-house legal departments. So how do you see big law in particular adapting, as this area is now clearly a critical component of regulatory, corporate, litigation even needs of the biopharma industry, not to mention how it spills over into licensing and deal work? Any thoughts there?
I have lots of thoughts, and we probably don't have time to cover them all, but I am happy to lean into this topic in particular. It's a passionate one of mine. I've had the privilege, as Chris, spent decades, building a career in this area. And so we've seen, these issues kind of bubble up from their, origins into massively consuming the space and the attention as these issues drive profitability decisions, more and more on a global basis for leading life science companies. And I, for a number of years, been very focused on making sure we're upskilling and the next generation of lawyers and professionals that have deep knowledge in this space and are excited about it because these issues are not going anywhere anytime soon, or what I like to call democratizing knowledge in this space, because a lot of lawyers run away from this topic because they hear things like best price and 340B and all these different programs, and they say, this is way more complicated than I ever want to think about. And so, as you guys well know, I worked with my former colleagues at Covington to publish a significant treatise in this space that's available at the American Health Lawyers Association website to help just take away and tear down a little of the fear of engaging in this area by breaking down each of the different programs chapter by chapter and giving you the glossary and the lingo so you could go back to it as a resource, and would encourage folks to take a look there. But it's all in an effort to realize that there just aren't enough seasoned lawyers that understand this space at a strategic level and can advise biopharma in the needs that they have going forward. And especially, post IRA should have been a wake up call for anybody that market access is, like I call it, the new quarterback of pharma. I used to get skepticism around that when I used to give that talk about 8 years ago. Now it's a universal truth at the end of the day. And I do think, big law in particular, especially those with substantial DC based practices that govern regulatory, corporate, and litigation needs of these, amazing companies and the innovation that they're driving, need to be, well staffed and well structured to do this in a strategic way. And, I think we're going to see, or God, I know, we're going to see more. We're on the precipice, I think, of a significant amount of new litigation and enforcement work related to these issues. Full stop. There's no question about it in my mind where we're headed, and we can go into all the different reasons why. And I don't think this is the type of thing that, a general commercial litigator can just come and take and run with, or just because I spent some time at DOJ, I can take and run with cases in this area. If you don't have the deep substantive knowledge, or at least have those that you can bring onto the team in a meaningful way and do on a regular basis, especially if you're looking to achieve outsized successful outcomes for your clients, right? I mean, anybody can take a case and litigate it, right? Whether you're going to get an amazing result is going to depend on who you bring to the table and the team you field in that area. And I think we've seen examples where people have maybe taken cases in this area where they're head of their skis and the litigation results are not optimal, right? And I think general counsels are looking at that more. And I think you're seeing maybe just a handful of firms at this point that are really building the type of team that you need around these issues that can give that strategic support to manufacturers. I wish there was more of them. Again, I'd like to see more kind of lawyers come into this space and encourage it. But I feel like in some ways, there's just not enough talent for the needs that are needed. And these general counsels and in-house teams are also themselves getting much more sophisticated in these areas. You see many more in-house lawyers learning these areas as a way of their day-to-day activity. We should all be doing, and this podcast is doing a lot to help create excitement and interest in this area. But I do think we're going to see a significant separation in terms of those firms that have teams that can handle high-level strategic market access and pricing work that comes across regulatory, corporate, and litigation going forward.
Yeah, I think the integration of the teams that you mentioned, for example, I'm not a litigator, I do litigation. I've supported the litigation folks, right? Because that marriage of the substantive knowledge, the subject matter expertise that we hopefully can bring with these other areas, these other teams is really the key. And that has been a theme on this podcast from other guests, certainly as well. I mean, I would say, let's not forget market access. What is this market? It's patients, right? At the end of the day, we're trying to get medications into the hands of patients. And how can we make that happen? How can we get to that success? Because ultimately, that is the success. I would also say, in terms of the complexity in this area, to me, it's more an issue of volume. Once you kind of break it down, you look at specific topics, let's face it, it's not rocket science, right? Each topic on its own, yes, is complex, but it's manageable. I think the challenge is more the volume. And I mean, we've heard it on the podcast today. How many distinct topics have we covered here today? Quite a large number, because there's definitely a lot going on. And I think, maybe from the specific issues, we kind of finally maybe turn to like a big picture question. Maybe, Rujul, I can hit you with that. What tips would you give to those listening on optimal ways to engage CMS on policy issues, and how can folks best reach out to you and get in touch?
Well, thank you for that question. It's going to make, my meetings hopefully more productive to those that are listening to your great podcast. Look, we've been very open. We take meetings that are requested, sit down, whether it's a live meeting or whether it's a virtual meeting. We want to hear the voices of all major stakeholders that have meaningful interactions with CMS and the programs. And I would say too often people don't come with enough homework done when they come to us, right? It's one thing to come and say, look at this policy area. We'd like to do at a high level, see CMS do more deregulatory action in this area, or we'd like you to take more greater kind of enforcement or oversight in this area, but you're lacking the specifics, right? And yes, it is on us to drive the specifics at the end of the day, but you could do some of that homework for us, right? And not just in a high gloss, way, but ways in which you say, here's what we think the issue is. Here's where we think you have the authorities to act, right? Or, here's where we think you may be lacking. And here's a timeline you should do it. This is why this doesn't need to be done through statute, it can be done through rulemaking, or, here's why you should, take this issue over another one in prioritization and really spell that out in a meaningful, meaty way, right? I mean, some of us that deal with these legal policy issues, like to get significant memos that have the right footnotes on where we can look to and where we can go. So it's more actionable, right? So it's one thing to have a meeting and have a nice, conversation of exchange of ideas, right? It's another thing to have a productive meeting that results in concrete action steps that you've helped the agency kind of tee up in an easy way. And I would love to see more of that when people come in.
Well, Rujul, thank you. We are so grateful for your time here today on our pod. Thank you for sharing these insights with us, particularly that last bit on how people approaching CMS, whether it's stakeholders, can do so in a way that is much more beneficial than maybe they have in the past. I know I've certainly learned a lot today. I know our listeners probably have as well. So, given us a lot to think about, we really appreciate it.
Yeah, I feel vindicated because I've been accused of over preparing for these government meetings. Now I feel like I did the right thing. So that's
Absolutely did.
great to hear that.
Your clients are better for you having done that for sure.
Well, Rujul, it's been great to hear your views on these many diverse issues and topics and the practice pointers that you shared. And so I want to thank you again for taking the time out of what is obviously a busy schedule to come on the podcast today. And I think with that, why don't we go to the question we had posed at the very beginning? Which Olympic sport is it like? And Rujul, maybe we'll start with you. What do you think? Which Olympic sport have you selected?
Sure. So I think I'm going to pick one that most people have probably never heard of, which is men's field hockey. Okay. And I'm going to pick this topic for a few reasons. One, I grew up in central New Jersey, about 10 miles outside of Princeton. So this Northeast corridor tends to be a part of the country where people play field hockey, but it's mainly a women's sport in the Northeast, and especially at private schools and the like, and high schools, at least in New Jersey, from what I remember. But internationally, it's the opposite, right? It's actually played mainly by men, and it's a significant and popular sport. And so you have this kind of international dynamic that's very different ex-US than it is in the US. And so we'll pick that as a layer around that. I actually had the benefit of through my time playing tennis, got recruited to play on a men's field hockey team at the state level, and ended up being on a kind of I think we won a gold 3 years in a row due to the fact of having a U.S. Olympic athlete on our team, which is a good ringer to have anytime you want to try to win a state championship at the end of the day. But, you also have this, it's an interesting sport because you can only use, unlike regular hockey, you can only use one side of the stick to touch the ball as you move it along up and down the field. So it's got a kind of complicated set of ways in which corners work, and, and rules that are just not the way Americans think about hockey in particular. And so that's why I picked it, given some of the international flavor of the MFN conversations that we've had.
That's a good one, Rujul. Definitely an interesting one that I had myself not even thought about before. I don't think I've heard of field hockey before, so good to learn today. I myself went with archery, which has been described as the ultimate test of precision and focus. Today, Rujul shared with us the various developments at the agency that we need to be tracking, and quite frankly, that require, I'm sure, an incredible amount of precision and focus, both from policymakers at CMS, but also from pharmaceutical manufacturers who seek to be compliant and to work collaboratively with the agency. So I went with archery. Chris, what about you?
Yeah, definitely makes sense. Archery was on my short list. I ultimately went for bouldering, which is a flavor of sport climbing. And so in bouldering, our athletes climb these high walls without ropes in a limited period of time and in the fewest attempts possible. And it's sort of this artificial environment. You don't do it outside. You do it with these artificially set up courses, basically. And that seemed apt to me today because it's limited period of time. Get it done with the fewest attempts possible. Be very strategic and effective, like we heard today, and we've said many times. Having a team that supports that effort is really what it takes. So one person ultimately does the climb, but they couldn't do it without the support. So bouldering seemed the thing to me that made sense. I think with that nicely wraps up our podcast. And usually at that point, we turn to Danny to ask, where are we going for the after party? But Rujul, I know you are a connoisseur of the culinary scene in DC. So I'll turn it to you. Where are we going for the after party?
Fair enough. Well, one of my favorite parts of town is the wharf, where I do have a place. And one place I recommend to folks, especially this time of year, as the weather is perfect before it gets too hot and muggy, is Lamani, which is a Mediterranean restaurant there with amazing views. But in particular, their third floor is open air and they have it happy hour there. That's 7 days a week and goes till 8 p.m. Probably one of the best happy hours in town in terms of the view, the food, and the amount of time you can still catch it. So hopefully we'll see many of you there.
Well, Rujul, that sounds great. I can't wait to go. It's a beautiful day today here in DC, so perfect spot. Thanks, Rujul, for joining us today and sharing valuable insights and updates regarding CMS and important policy topics. And thanks to Danny for being a moderator. And thank you to our listeners for checking out the Latham & Watkins Drug Pricing and Market Access series, which is part of our Connected with Latham podcast. You can subscribe and listen to new and archived episodes of Latham's podcasts on lw.com, Apple Podcasts, Spotify, or anywhere else you listen to podcasts. If you have questions or would like additional information, please email us using the links located in the show description. We hope you'll join us again next time.
This podcast is provided as a service of Latham & Watkins LLP. Listening to this podcast does not create an attorney-client relationship between you and Latham & Watkins LLP, and you should not send confidential information to Latham & Watkins LLP. While we make every effort to assure that the content of this podcast is accurate, comprehensive, and current, we do not warrant or guarantee any of those things, and you may not rely on this podcast as a substitute for legal research and/or consulting a qualified attorney. Listening to this podcast is not a substitute for engaging a lawyer to advise you on your individual needs. Should you require legal advice on the issues covered in this podcast, please consult a qualified attorney. Under New York's Code of Professional Responsibility, portions of this communication contain attorney advertising. Prior results do not guarantee a similar outcome. Results depend upon a variety of factors unique to each representation. Please direct all inquiries regarding the conduct of Latham & Watkins attorneys under the New York's disciplinary rules to Latham & Watkins LLP, 1271 Avenue of the Americas, New York, New York, 10020. Phone number 1-212-906-1200.